name is Dr. Helen Burstin. I am a clinical professor of medicine at GW Medical School, and I am the CEO of the Council of Medical Specialty Societies. My interpretation of being a better ancestor is ensuring that whatever we do in this world makes it better for the generations that follow us. We should not leave them issues that we could have dealt with and chose not to, and leave them work that they need to do that we should have done in our time. Interestingly, what motivates me to be a better ancestor are my ancestors. So my family are all Holocaust survivors. My parents, my father was in concentration camps, and my mom was in work camps in Siberia. And so we have almost no family who have survived the Holocaust. And so I have always been motivated by making sure that no one is ever again treated as the other, and because of that, hurt in some way. And sadly, we are seeing that happen again right now. Yeah, so I think the legacies of the past for me really operate at two levels. One of which is, again, having had family treated as other, less than human, and killed for that, means that I'm deeply committed to making sure that doesn't happen to anyone else. But I think as I interpret it through the lens of my practice and my work and my advocacy over the years, it extends to the other beyond my family. So the work that I have done in healthcare equity, the work that I have done in particular with Latino populations and populations who don't speak English, anything again we can do to avoid people being othered in a way that lets them, makes them vulnerable to people's inequity, not giving them the services they need, not giving them the care they need, is what motivates me. The world I want to leave behind for our communities broadly is a place where we have really done our job and have tried to reduce injustice. And through my lens, particularly in healthcare, is where I feel like we can have the most impact. And as an example, the work we're doing right now to remove race and ethnicity from clinical guidelines and clinical algorithms, which we know have caused harm for certain patients who have not had access to life-saving therapies like kidney transplants and others. And so that work, for me, feels very much along that same pathway of saying, what can I do to make sure that future generations and our legacy is such that every patient has the opportunity to have the best possible outcomes, regardless of who they are. My name is Helen Burstin, and I pledge to be a better ancestor.